Welcome back to It's Personal. It's Personal is brought to you by Gunderson Health System. I'm Chris Stauffer. Well, what are the predictions for the flu in the year 2019? Joining us to talk a little bit about that is from Infection Control, Megan Meller. Thanks for being here.
Thanks for having me today.
You know, the flu is something that it seems like we talk year-round about anymore, and I think that is probably appropriate because the flu is year-round, not necessarily always in our backyard, but I know in talking with you that Australia, in our summer months, is going through the flu season. So that has an impact on what is predicted for 2019-2020 flu season here. How does that work?
So Australia's winter is our summer. And just kind of the way that, these viruses circulate, it means it really is a good predictor for us. And, we've looked at years past and historically, whatever they're experiencing, in terms of severity of their season, ours tends to mimic that just for whatever, for whatever reason.
History proves that, yeah.
History proves it. Which means we really need to be cognizant of the vaccines that we choose. And so every year, following the closure of the flu season in the summer hemisphere, scientists get together and they start looking at what strains were circulating during that time, like which ones were causing the majority of the illnesses. And they use that data to then develop the vaccine for the northern hemisphere. So based off of last year's flu season, we've made changes to our own vaccine. So we've made the H1N1 strain, so influenza A we're talking here. So H1N1 and H3N2 strain components were changed, which is, it's great. So H1N1 tends to be a little bit more stable in the vaccine, so we tend to see a better protection against that one throughout the flu season. H3N2 is a little bit different. It tends to, what we say, evolve a little bit faster during the vaccine development process, which means it might be a little less effective than H1N1 in terms of protection against whatever of that strain is circulating. Sure. But it still offers its own sort of protection in the sense that you might still get sick from it. We see people who have gotten vaccinated and who
But it might also shorten the duration
exactly
of how long you have the flu. 10 days might be the full-blown flu.
But you might only be sick for 4 or 5 days. Mm-hmm. And the severity, too, it really impacts the severity.
And
so instead
lives.
It ultimately saves lives, prevents hospitalizations, which we're all about in healthcare, is preventing hospitalizations and saving lives.
So we know some of the data as to how our flu shot, if you will, has been evolved or changed based on what happened in Australia this past summer for us, winter for them. But what about their flu season? Did they have a significantly bad flu season in Australia, and can we anticipate that here?
I first want to say each flu season is different. It's hard to truly predict what it's going to look like, how early is it going to start, how late it's going to last.
Having said that,
the Australian flu season, they saw it start earlier compared to previous years, so it was an early start. And it was an early end as well, but in the middle, it hit pretty hard. It was a fairly severe flu season with regards to hospitalizations and deaths. Some reports considered it more severe than the 2017-2018 flu season, which is when we also had a pretty severe flu season. So again, that early start, high number of hospitalizations, high number of predicted deaths. And so by considering all of that, it has created a sense of urgency over here to promote getting vaccinated as soon as possible.
I know that Gunderson is offering flu shots as we speak. You can certainly stop by and get one. Other places offering them as well. But when it comes to getting that flu shot, a lot of people like alternatives. Are there new alternatives out there? I know in the past the flu mist has been an option, especially for kids, but it's also gone away for a couple of years, and it came back, I believe, last year for the first time.
So there aren't any new vaccines on the market. So the vaccines that Gunderson is offering this year are the same that we offered last year. So again, flu mist is back. We have it. We've received our supply, and that you're right. That is a very popular one, for kids and even some adults because they like the needleless option, and you tend to get a little bit of a stronger immune response to the flu mist. But not everyone can actually receive flu mist, and so we definitely recommend having that conversation with your healthcare provider to figure out what vaccine is the best for you. But we still have vaccine. So we have our standard quadrivalent vaccine. So what I mean by that, it has 2 strains of A, so the H1N1, H3N2, and then 2 strains of B. It's a good vaccine. Many people will receive it. But then we have more, we call them like higher dose or concentrated vaccines. And those we want to reserve for our more vulnerable population. So we have the high dose vaccine, which is all of those, all of those strains, but at a higher dose. So you're going to get a little bit of a better immune boost to the vaccine. So those are for our population over 65 and older, because at that age your immune system is starting to wane, so you do have some vulnerability to getting the flu. But then we also offer the flu block. So flu block is another type of vaccine where I think it's just 3 vaccines rather than the 4, but you still have the 2 A's and 1 B. But again, it's a higher antigen quantity, so you're going to get a better, more robust immune response to the flu. And that is we were reserving that for our population between the ages of 19 and 64 who are immunocompromised or who have any underlying immune condition, let's say advanced kidney disease, lung disease, COPD, bad asthma, anything that puts them at risk for more severe complications against the flu. The flu block will help offset that and offer some of that initial protection.
Someone with a bad immune response, obviously having the flu could be an extended amount of time dealing with the flu.
Absolutely.
Could cause other complications, even death.
And it could result in some exacerbations of your existing chronic diseases. So you might see, let's say, flare-ups related to lung disease or kidney disease or COPD flare-ups. Another thing that a lot of studies have started to show is that the flu vaccine, people are more at risk for developing strokes and heart attacks during the first 3 to 4 days of fighting off the flu. That is how strong the body works to try to fight off the flu, that it changes their heart rate, changes their blood pressure, and puts you, that's what many of the deaths are due to from the flu.
And that's even in a healthy individual.
And that's in a healthy individual.
Healthy,
or even, there's reports of multi-system organ failure because the body is working that hard to fight off the flu. And so by already giving it that exposure to the vaccine, you are cutting that chance down by up to some studies have shown up to 45%.
I've heard people say that have had the full-blown flu that it feels like you just want to die because you are feeling so lousy. It's the headaches, it's the body aches, it's hard to describe, and that's why a lot of people think, though, when they are down for a few days that they have the flu when it actually is more likely a virus, a cold.
Right. I think I had the flu myself last year. I got the vaccine, but got the flu, and it hit fast. I had the rapid heart rate. I had the chills, but I was recovering within a day. So 24 hours of that hitting hard, I was already recovering. And that's a strong testament just to how well that vaccine works, because you're down for 2 days and you're able to bounce back really rapidly, and you're not having, yes, some of the symptoms were severe, but it resolved fast.
And imagine being an infection control preventionist during the flu season, having the flu and being out for 10 or 15 days because you're recovering. So a little bit of a joke there, but at the same time, it's very serious.
It really just emphasized to me how important the vaccine is.
Yeah. The other thing that I want to talk about is another reason that it's so important for healthy individuals to get the flu vaccine is because not everybody can get the flu vaccine. So there's sort of that what's called a herd immunity. Can you elaborate on that just a little bit? So
herd immunity is not unique to the influenza field. It's something we use for all of our immunizations. And it's looking at basically what you touched on, is that there will be a subset within our population who cannot be vaccinated for whatever medical reason. And it is that population that herd immunity protects. So the definition of herd immunity is if enough of a population is immune against a certain illness, let's say the flu, it can't spread from person to person as fast. And so if it can't spread to enough people, it's not going to infect the one person who isn't vaccinated.
So as much as we say, do it for yourself, in many ways you're doing this for others as well who are not able to get that flu vaccine.
And I think the best example of this would be the newborn. So anyone, any child under the age of 6 months, because they might have a little bit of protection from their mother if their mother was vaccinated, but they're still very vulnerable to getting the flu and very much at risk. And so thinking about it that way, you would want to make sure that the father is vaccinated, any siblings are vaccinated, grandparents, nieces, anyone who might be coming into contact with that child is vaccinated, because then you're decreasing the likelihood of them actually getting sick.
We're talking with Megan Meller, infection control preventionist at Gunderson Health System, about the flu season. People can get their flu shot right now. They can go to many different locations, Gunderson being one of them.
Correct. So at the start of the school year, we were already starting to get a little bit of a supply in. So we were really advocating to get those kids who are coming in for their sports physicals to get vaccinated, because it can be hard to wrangle kids, later on during the busy school season. We do have, we're recommending to anytime you come in for an appointment, ask if you can get your flu shot, because many departments will are carrying the flu vaccine. So it's a great time, just to, so to speak, kill two birds with one stone and get your flu shot.
I know that when people come in to get their flu shot, or it's brought up by their provider, they have questions. What are the questions that mom has when she's bringing her children in for a regular routine exam, and they say, do you want to get the flu shot today? What are they bringing up to their providers?
We don't know exactly, but there are things that we wish providers would, discuss in more detail with the parents, and that is, the parent might come in later and say, or call and say, my child is feeling a little under the weather, might have a slight fever.
After a flu shot.
After the flu shot, and they think that the flu shot gave the child the flu, and that's a common misconception. So that's actually the body's immune response working and developing, again, a response to the flu. So as long as it's low grade and they recover from it, that is perfectly normal. But there needs to be that disclosure from the physician to the parent to let them know about that. So that, again, that's the biggest misconception is so you cannot get the flu from the flu shot.
But very common not to feel great, maybe the
Right.
day after or 2 days after, or you just feel a little bit under the weather, down, blah. Right.
Blah. And there are the rare events where let's say someone does come down with a full-blown flu right after the flu shot, and that's because you were exposed to the flu prior. So the flu, we call it an incubation period. So it kind of takes about 3 days to cook in your system before you start experiencing any symptoms. And so that's also a likelihood, a possibility is that the child was already exposed to the flu.
We should talk a little bit, if we can, about vaccination rates within our community and the communities that Gunderson serves, which is multiple counties in both western Wisconsin and southeastern Minnesota and northeastern Iowa. We know that. How are the vaccination rates in this area, and is there any concern about those rates?
So it's hard to say, within this area. I don't have access to that data, but we can look at it statewide. And so even comparing influenza vaccination rates to other mandatory childhood vaccines, it's still pretty low. So I think last year, the state of Wisconsin...
And I think that's maybe surprising to a lot of individuals who
are in healthcare.
Yeah, right.
So last year, I believe the vaccination rate for the flu was between 36 and 37%. Statewide. The goal is 80%.
Mm-hmm. So falling well short of that goal.
But we did better than the year before. So I guess every year, it's always good to see a little bit of improvement. And we can compare different age groups. And so, we're seeing, that the elderly, that they are, they're hitting close to what they should be in terms of, overall vaccination rates. But we tend to see it, dip a little bit in the young adults. So, even the 20, 30-year-olds.
Interesting. Now, I know that a lot is being done to try and educate all of us about the importance of getting vaccination, whether it's the flu or other things you need to be immunized for. What, other than talking on the radio like we are right now, or just talking about it in the media, what other efforts are underway? What is the CDC telling you that as a preventionist you need to be doing?
So they're not really telling us anything because there's only so much that we can do. And I think a lot of it is popular opinion, social media. Social media has a really strong kind of foothold, positive and negative in terms of flu vaccines. I've even heard from close friends that they're like, oh, well, I got the flu shot and then I, got the flu, so it's not that effective, or these organizations are saying that the flu vaccine isn't effective, so why even bother?
Common myths.
Common
yes.
myths. And so my best retort is, okay, you got the flu, but how sick did you get? And I think that the more we have those conversations about, but if you get it, you're not going to be sick, as sick, you're not going to be sick for as long. I think then we'll start to see a slow uptick in getting the flu vaccine. That said, we're also seeing, there's the low cost to no cost of getting the flu vaccine, which is overcoming a really great barrier to it. And, to getting it, it can be access. So it's looking at your vulnerable populations or your populations that may not have the best access to getting the flu vaccine. And so that's where public health departments can come in and can help disseminate the vaccine that way. There's pharmacies that are using incentives to try to bring people in to get the flu shot. So I think there's a lot of efforts that are underway. And if we were to see a jump from 30 to 80, I'd be like, okay, what's going on?
Mm-hmm.
So I'm happy with the steady improvements that we're seeing each year.
Do most insurance companies cover flu shots?
Most, if not all, insurance companies will cover the flu shot at no cost or at a very low cost. When I say low cost, I would say between $10 to $25.
Mm-hmm. And, of course, it could be life-saving, as we discussed.
Absolutely.
Yeah. We're talking again with Megan Meller, infection control preventionist at Gunderson Health System, about the flu season. And I know that each year we have our first case of the flu. It can come in early, it can come in late. Based on what we heard in Australia, it came in early and then it came in hot and heavy. Mm-hmm. When we start talking about our flu shot rates and starting flu vaccinations in late October or, really in October and then now lasting here through November, is that a concern for infection control preventionists statewide and throughout the Midwest? Are you all just sort of waiting for that day to come where it's going to be as predicted, okay, this is that year that we were taught about in school?
I think it's kind of the same thing as with anything. We also think about that in terms of measles. It was happening nationwide. Is it going to happen here? With the flu, the best we can do is monitor. And again, our hands are tied a little bit by when we start getting our vaccine in. So we can only say, so much. But there are reports already from Iowa suggesting that they were having seeing a lot of flu cases already, and so we, with that, then we start kind of changing our messaging. We might do more influenza targeting towards our Iowa providers and nursing staff, saying, we're hearing it's happening in your state. Why don't we strongly advise everyone to go get vaccinated, so that way you have that protection. Whereas if we're not seeing it here yet, we're going to say, okay, keep on the straight and narrow. So, looking historically, flu seasons tend to be between January and March. So that does give us a bit of window. We'll always see some cases, maybe end of October, November, December, but it doesn't ever they don't really spike until the new year. So, we do have a window. Let's say even if it starts in December, if we're done vaccinating by November, earlier on, then we still have established that protection.
Megan, we could probably talk about this for a lot longer, but we really appreciate your time and all that you do to prevent the flu from happening in the first place in our area, and also getting the message out about trying to get that flu vaccination. We know that it saves lives. We've seen it occur. Megan, thank you so much for joining us.
Thank you for having me.
And I hope you have a really low-key flu season and that vaccination rates rise up well above that 80%, that they skyrocket. Megan Meller, infection control preventionist at Gunderson Health System. That's going to wrap it up for this edition of It's Personal. It's Personal is brought to you by Gunderson Health System. I'm Chris Stauffer. Thanks for joining us.